Hello, everyone, and a big thank you to those joining us live, as well as those listening in later. I'm delighted to warmly welcome our special guests today, who we will introduce shortly. My name is Dalia Bajis, and I am Senior Program Lead at FIP, the International Pharmaceutical Federation. Before we begin, I would like to share that FIP's vision is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technologies. Our mission is to support global health by enabling the advancement of pharmaceutical practice, the sciences, and education. Today's event is titled Mental Health Care in Focus, Empowering Pharmacists to Enhance Patient Care in focus countries, Turkey, the United Arab Emirates, Saudi Arabia, and India. So welcome, everyone. Thanks. I would like to also extend a warm welcome to FIP's Community Pharmacy Section President, Mr. Sherif Guorgui, who will be moderating the panel discussion with me. Additionally, I want to acknowledge the support of FIP staff, Dr. Ozge Ozer and Marianne van der Veen, who are working behind the scenes to ensure the smooth running of today's event. Today's webinar promises to be both informative and engaging, offering interactive opportunities for audience participation. So throughout today's session, colleagues, attendees will have the chance to engage through live polls, making the experience more dynamic and allowing for real-time feedback and input. So we really encourage you to stick around and to actively participate in the upcoming discussions. Before we proceed, we have a couple of housekeeping reminders to you all. As you can see on this slide, we have some announcements, as I said. Please note that this event will be recorded, live streamed on FIP's YouTube, and recording will be available at the conclusion of this event at events.fip.org. To everyone listening, please feel free to submit your questions using the Q&A box provided. I will also do my best along with Sherif to manage all of them, and we will make sure to address as many of them as possible during our Q&A and panel discussion. You are very welcome to provide us feedback by writing to webinars@fip.org. And if you're not already a member of FIP, I'd like you to consider the opportunity to becoming a member and to availing of the multiple benefits of FIP membership, including such events and webinars. Some of you might know that FIP is the global body representing over 4 million pharmacists, pharmaceutical scientists, and educators. And if you would like to become a member, please do register on FIP's website at fip.org. The event is also being translated into Turkish for our Turkish-speaking audience. We would like to also acknowledge that this event is sponsored by unrestricted funding from Boehringer Ingelheim. Thank you. For this event, we are honored to be joined by a panel of fabulous and highly esteemed speakers from those 4 countries. And I really would like to sincerely thank on behalf of FIP, each one of them, for taking the time to be with us today. Our guests will be introduced shortly before their presentations begin, but I'd like just to say welcome to the Associate Professor Zekiya Kubra Yilmaz from Turkey, who is a clinical pharmacist and also a member of the Turkish Pharmacists Association. Welcome, Zekiya. We're also delighted to have with us Dr. Nadia Al-Mazroui, who is an Associate Professor at the University of Sharjah in the UAE. Welcome to you, Dr. Nadia. Welcome to Dr. Mohammed Al-Shannawi, who is the Vice President of the Saudi Pharmaceutical Society from Saudi Arabia. And we're also delighted to have with us today Dr. Neha Kag, who is the Director at the Ministry of Health of the Family Welfare part of the Government of India, from India. Welcome, Dr. Neha. Colleagues, before we proceed with our program, and on behalf of FIP, I would like to take a moment to acknowledge that we are facing a critical moment for the international community, marked by unprecedented humanitarian challenges and crises. As these crises converge, they highlight the urgent need for global solidarity and concerted action to alleviate suffering and build resilience. Since the focus of this event is on mental health, we must also recognize the profound impact these atrocities have on both the public and healthcare providers. We stand in solidarity with people everywhere, along with our colleagues in the profession, united by our shared humanity. So we can proceed now with announcing today's program. As you can see on your slide, the program is outlined as follows. We will start with a presentation from Professor Zakia from Turkey, and then we will move on to Associate Prof. Nadia Mazrouia to talk about mental health in the UAE. This will be followed by a presentation from Dr. Mohammed Al-Shannawi from Saudi Arabia, and we will also conclude with a presentation from Dr. Niha on mental health in India. I apologize on the typo on the slide, Dr. Mohammed. It is Dr. Mohammed Al-Shannawi. Then we will proceed with an hour-long panel discussion moderated by my colleague Sherif, supported by myself. The learning objectives for today's event. We really hope that our attendees will engage and understand a bit more about the pharmacists and policymakers' engagement in discussions on integrating mental health into clinical practice, public health and self-care strategies, that they'll be able to identify barriers preventing pharmacists from accessing mental health support and the skills necessary for conducting effective mental health consultations. And finally, that we'll all be able to explore the needs of pharmacists in providing mental health care to patients and identify opportunities for improvement through collaboration with government, healthcare systems, and industry stakeholders. Okay, this now brings us to the first interactive activity with our audience, and it is the first poll that will appear on your screen in just a moment, asking you to consider, what do you think is the biggest barrier to integrating mental health services into everyday pharmacy practice? And you are offered 4 options to choose from. A poll will appear on your screen shortly. Please take a moment to read the question and select your answer. Once you've made your choice, click Submit. Thank you, Marianne. We can launch the first poll now. Just going to give everybody a few seconds to log their response. What do you think is the biggest barrier to integrating mental health services into everyday pharmacy practice? And here are the 4 options. Is it in relation to training and continuing professional development or continuing education? Is it in relation to insufficient collaboration or support from other healthcare professionals? Is it in relation to regulatory or reimbursement challenges? Or is it associated with stigma around mental health? Thank you so much, Marianne. And we do have the response appearing on your screen. And we will allow for our presenters to also reflect on this. And it seems that 56% of our audience today believes that one of their biggest barriers is the lack of specialized training or continuing education in the area of mental health, followed by insufficient collaboration, and then thirdly, by the stigma around mental health. Thank you so much for your participation. On that, we would like to point you to an extensive library through FIP resources on mental health that you could explore at your leisure after this webinar. Our resources include a number of handbooks for pharmacists in the area of mental health care, also an associated knowledge and skills reference guide for professional development in mental health care. What are the knowledge and the skill areas that as pharmacists we might want to upskill in or know about to support us in this role? We also have other resources that are listed on the screen, but also if you go to www.fip.org/publications, you will be able to find more. And I will drop that in the chat box for you in just a moment. I would also like to welcome you, as appears on the next screen, to explore the FIP microsite, a dedicated microsite on mental health for you to learn more about our initiatives and our activities. Finally, like today's event, there are also a number of other events that focused, touched upon, discussed the pharmacist role in mental health care, but we also have a couple of digital events that looked at pharmacists themselves dealing with pharmacist mental health burnout and how we can support them improve their own well-being in the workplace. I hope this has set the scene for all of you colleagues. And now I would like to hand over to my colleague, Sherif, to introduce our first speaker. Over to you, Sherif. Thank you so much.
Thank you so much, Dalia. I'm very pleased to be co-moderating this webinar today with you. And it is my pleasure to introduce our first speaker, Dr. Zakia Kubra Yilmaz. Dr. Yilmaz is a clinical pharmacist and the head of the clinical pharmacy department at Asibarim Mehmet Ali Aydin Lar University. She completed her undergraduate and PhD studies in the clinical pharmacy at Marmara University. Dr. Yilmaz has served in various academic roles, including as an assistant professor at Birun University and a part-time lecturer at Trakya University. She is a co-founder of Turkey's largest online drug information center, an active member of the European Association of Clinical Pharmacy, and a published researcher with numerous articles in international and national journals. Welcome, Dr. Yilmaz, and thank you for being with us today. I will now turn the floor over to you.
Good afternoon, everyone. Thank you for your announcement. I am Associate Professor Dr. Zakia Kubra Yilmaz. First of all, I want to thank the FIP for their invitation. Today, I'm attending this meeting on behalf of the Turkish Pharmacists Association. First of all, I would like to talk about the learning objectives of my presentation and then its content. And then I would like to discuss the need for pharmacists within mental health plans. When we look at the learning objectives of my presentation, first of all, I want to mention about the necessity and anticipated advantage of pharmacist participation in the National Mental Health Action Plan. And the second, challenge pharmacists may face in delivering mental health services. And third, critical competencies pharmacists require for effective mental health counseling and potential strategies for addressing these challenges. The contents are similar with the learning objectives when we talk about the contents. The first content is, can we pass the slide, please? First of all, I want to tell a little bit about World Health Organization mental health policy, and then Ministry of Health of the Republic of Türkiye National Mental Health Action Plan 2021 to 2023. And the necessity of pharmacist involvement in the National Mental Health Action Plan and expected benefits of their participation and barriers to pharmacist provision of mental health services and potential solutions. When we look at the World Health Organization's mental health policy, the World Health Organization defines mental health policy as a set of principles, values, and goals designed to improve mental health and reduce the social burden of mental disorders. And the ultimate goal of our country's, Turkey's National Mental Health Action Plan has been determined as to implement an integrated community-based mental health service model in mental health services to monitor, protect, and improve the health of individuals. In our country, the mental health service model in the 2021-2023 period is planned to be provided to a population of approximately about 250,000 people with community mental health teams. And it's aimed to create an integrated mental health services that include primary healthcare services, community-based mental health services, social care support services, and specialized services to be provided regionally for individuals with complex needs. And these community mental health teams are planned to consist of at least one full-time psychiatrist, 2 nurses, and at least 1 part-time psychologist and 1 social worker. However, there was no pharmacist in these teams. And when we look at the table 1, we can see the mental health goals and objectives in the 2019-2023 strategic plan of the Ministry of Health. And here we see the aim, the first aim, to promote and spread healthy living. And for getting this aim, their target is to protect individuals from risks related to mental health and raise awareness about mental disorders. And the second aim, to implement an integrated health service model in health services. And for this aim, the targets are to protect individuals from to monitor, to protect and improve the mental health of individuals, and to ensure that individuals with special needs due to their physical and mental conditions have easier access to appropriate health services. Of course, these are not all of the aims and targets of the strategic plan, but I just put here a little bit because of the time duration. And when we look at the mental health goals and objectives in 2019-2023 strategic plan of the Ministry of Health, we see that these goals and objectives are closely aligned with the role and responsibility of pharmacists in public health. I mean, protect, increasing awareness, monitoring, follow up the patient. And when we look at the Ministry of Health Service institution providing mental health services in primary health settings, we see that they include family health centers, migrant health centers, health lab centers, community health centers. But however, the community pharmacies are not present here. On the other hand, community pharmacies are the most widespread healthcare service providers throughout the country in Türkiye, with a number of exceeding 27,000. And so I want to show you the importance of pharmacies being in the mental health plan with one more slide. Can you come back to next slide, please? The other one, please. Next one. Yes, thank you. Here we see in Türkiye increase in the consumption of nervous system medicines according to years. And when we look at the table, on the first line, we see that amount of nervous system medicines sold per year in million boxes. In 2017, 298.4 million boxes of nervous system medicines sold. And when we come to 2022, we see that these numbers increased to 377.5. And when we look at the daily drug consumption amount per 1,000 people by year, we see that in 2017, 98.4 boxes medicines are consumed. But when we come to 2022, we see that this increased to 117.8. So here we see clearly that there's an increase in the usage of the nervous system medicines, and these medicines are the responsible providing information to patients, society, etc., are the responsibility of the pharmacists. And so when we come to the next slide, we can clearly see the significance of incorporating pharmacies into the National Mental Health Action Plan. Why? The first one is community pharmacies are one of the few healthcare professionals that are easily accessible, have well-suited location in the community, and have long working hours. And second, they can provide information and educational support to the patients, parents, and the caregivers about mental disorders, symptoms, and disease complications. So thereby, they can increase awareness regarding the mental health, treatment plans, etc. in the society. And thirdly, community pharmacies can play a significant and effective role in delivering counseling services related to drug-related problems, including irrational medicine use, drug interaction, and adverse drug events. Because as you know, especially with some specific medicines which are effective on the central nervous system, some side effects may be commonly seen or maybe misuse of the medicines. So providing patient counseling is very important at these topics. And in Türkiye, community pharmacies are one of the primary healthcare settings, not only for dispensing services, but also for medication review, educational support regarding drug-related problems, and disease counseling services. So briefly, we can say that community pharmacies play a crucial and influential role within the healthcare system in Turkey. On the other hand, there may be some barriers that community pharmacies may meet during these roles. And when we come to the next slide, we can see the barriers. The first barrier can be lack of information. Pharmacists may have a lack of knowledge regarding some mental disorders because it's not possible to cover all mental illnesses during undergraduate education, or information may be forgotten over time. However, these deficiencies can be eliminated by providing vocational training. The other problem may be communication skills, because the pharmacists may need some development of communication skills as they will be in contact with a patient group with special needs and sensitivities. I mean, the patients who suffer from mental disorders. So these needs can be addressed by providing vocational trainings again. And the third one, increased workload, because in addition to daily workload of pharmacies, it can create time and workload problems. However, determination of priority patient groups can be beneficial to overcome this problem and spread it over time, I mean step by step. And lastly, standardization may be a barrier, but by creating easily applicable guidelines and directives in the field of mental health, this problem can be overcome. So the pharmacist is the closest health advisor and should be included in the mental health plans. In summary, community pharmacies, who are widespread healthcare providers across the country, have potential to make significant contributions to the National Mental Health Action Plan. Pharmacies can check the patient's adherence to treatment plan, detect drug disease interactions, provide patient education and counseling, and refer to physician in case of need. These are my references. Thank you for your attention.
Thank you so much, Dr. Yilmaz, for this fantastic presentation. I would like now to introduce our next speaker, Professor Nadia Al-Mazroui. Professor Nadia serves as an associate professor at the University of Sharjah, where she is also the chairman of the Experiential Training Committee. She has a rich background in clinical pharmacy and has earned her degrees from Queen's University of Belfast and Cairo University. Professor Al-Mazroui also held a number of significant leadership positions in various pharmacy associations and was president of the Eastern Mediterranean Pharma Forum and a member of various WHO advisory panels, in addition to being director of military medical services in the UAE. She has been deeply involved with FIP, contributing to various committees on pharmaceutical education, emergency management, and the Nanjing Statement Update. And she's also recognized for her many editorial contributions to international pharmacy journals. Welcome, Professor Nadia. Thank you so much for being with us today, and I will now turn it over to you.
Thank you, Mr. Chairman. Thank you very much for this nice presentation. I would like first to express my gratitude to the FIP and all the organization committee for this webinar. And this topic, I think it is very important, one that we need to concentrate in it. And the pharmacists play a crucial role in involvement in the healthcare and mental health in healthcare settings. So I'm going to give you an overview about the mental health in UAE. So our learning objectives will be increase engagement of pharmacists in mental health discussions. Also, we want to address the barriers like limited training and lack of awareness. We can foster collaboration among collaboration among government, healthcare systems, and the pharmaceutical industry. Our expected outcomes that a more inclusive mental health system of a pharmacist role, and also improve support for patients through enhancing the role of pharmacists. Next, please. So, if we speak about the mental health, it's now seen as a key public issue in the UAE, and due to rapid social and economic changes, increase the focus on mental health well-being as in our government. So the UAE government, particularly through their initiatives like National Policy for Promotion of Mental Health, which is started in 2019, had made a significant stride to address mental health challenges by promoting mental well-being, enhancing community awareness, and also improving mental health services. So, however, there is a gap remain, particularly in the integrated mental health, especially into general healthcare, self-care practice, and public health strategies still remain, it need to be advanced. The UAE also, from demographic composition, comprise a significant expatriates population present in distinct challenges also. So there is a cultural stigma around the mental illnesses, particularly in some expatriates communities, which can deter individuals from seeking help. Despite progress in mental health care services, which were being offered in our country, are often underutilized due to such stigma. So lack of awareness and the absence of a clear framework for integrating mental health into the primary healthcare settings, where pharmacists play a pivotal role in that. So next, please. So the gaps and challenges, which is, as we said, cultural stigma, and also which have negative perception on mental health, prevent also them from seeking help. Underutilization of services is the big issue also, that awareness is still limited. So mental health services are not widely accessed. Also, integration issues, this is the most important, is not fully integrated into primary health care. So pharmacists could play a great role in that issue, and but it faces a lot of challenges. Next, please. So, pharmacists are among the most accessible healthcare providers. This is a very important issue, that they can support mental health through general medication management, through counseling of medications and dispensing medications, and also through patient education, and also early intervention or early detection of these symptoms. Barriers to effective pharmacist involvement is like, it can be summarized in limited training in mental health care, or some regulatory constraints which is restrict their role in mental health services. Expanding the role of pharmacists can improve also and show a very big improvement through a lot of studies that it can improve patients' outcomes. Next, please. WHO also approaches that emphasize on the integrating mental health into all healthcare levels, especially in the mental health action plan, which was a guideline which support this integration, which has been introduced in 2013, and the plan till 2030. And most of the countries and the governments, they are applying this plan into their systems. Also, our key strategies in the UAE, that we are doing something called task sharing models, which is training the non-specialized workers like pharmacists for basic mental health care, Also, trying to addressing stigma, use community programs to combat stigma, and also educate, also introducing the pharmacists, they can educate the public. Capacity building, this is one of the issue that it is important to invest in the training healthcare providers, including the pharmacists, for better mental health support. Next, please. If we are speaking about the future direction, we have for the pharmacists, we have to engage the pharmacists and the policy makers together for the future plans. So it will expand the role of pharmacists in mental health care. Also, we should encourage policy changes to integrate mental health into pharmacy practice. Through addressing training barriers, also we can provide specialized training in mental health consultations, and we can promote awareness among pharmacists about their potential role. A collaboration for better care, this is a crucial thing, that it will create partnership with healthcare providers, governments, and industry. We should focus on improving access to mental health care to the maximum. The impact also will be a better access to mental health care, enhancing the outcome for patients through collaborative efforts. Next, please. Thank you very much for listening.
Thank you so much, Professor, for this very insightful presentation. A lot of great points, which I'm sure we will be talking more about that during the panel discussion. I would like to now introduce our next speaker, Dr. Mohammed El-Shennawi. Dr. El-Shennawi serves as the Vice President and General Director of Pharmaceutical Care at the Ministry of Health in Riyadh. He has over 22 years of experience at the King Faisal Specialist Hospital and Research Center. His expertise spans across operations, general management, and pharmaceutical care. He also founded and has chaired the Saudi Club for Narcotic and Controlled Medications Pharmacists since 2008 under the Saudi Pharmaceutical Society. His leadership skills are complemented by a robust educational background with degrees from King Saud University and Al Faisal University. Welcome, Dr. Mohammed, and thank you for being with us today. I'll now turn it over to you.
Thank you, Dr. Sherif, and thanks for this kind invitation from the FIB. In fact, the FIB is always pinpointing the areas for challenging the pharmacist and the areas for improving pharmacists all over the world. So thank you, FIB. Thank you for the organizing committee. Thanks for this invitation. FIB is always our umbrella that all the pharmacists worldwide is going under it. So we are expecting this from you, and we are expecting more and more, inshallah, for the coming years from the FIB. It's my pleasure here today to represent the Saudi Pharmaceutical Society to talk about the mental health for pharmacists in Saudi Arabia. I do not want to repeat whatever has been said by my tremendous, magnificent colleagues about the learning objectives. Already Dr. Dalia, she already mentioned the learning objectives, and I will not go out of those 3 learning objectives. So it's just only a reminder for everybody, if you can watch them in the slide. I would prefer to go directly to the next slide, please. Just a quick overview about the healthcare system in Saudi Arabia. Of course, the Saudi Arabia healthcare system divided into 2 sectors. First of all, the governmental sectors, which is responsible for almost more than 76% of providing healthcare services for the population. And the other sector is the private sector, which is almost responsible to provide the healthcare services for almost 24%. Private sector, it's divided either by private hospitals or insurance and out of the pocket. Governmental sector Majority of it, more than 60% of the governmental sectors, they are the Ministry of Health facilities, hospitals and primary healthcare centers. And the semi-governmental agencies, it's like security forces, National Guard hospitals, military hospitals. Those are the hospitals that they are engaged with another organization or another ministries in the country. Healthcare sector is one of the highest priority in the Saudi Arabian government. Even the article of the Saudi constitution 31 that Saudi state is responsible for providing healthcare for every citizen for promoting public health. In 2022, Saudi Arabian government spent almost $40 billion US in healthcare and social development. This is almost 14.4% of our budget in 2022. The third largest services that consumed budget after the Education, Ministry of Education and the Ministry of Defense. I am sure that everyone here, they knew about the vision of 2030 for the Saudi Arabia. Of course, we are spending in the next couple of years almost $65 billion US in building the infrastructure for the healthcare facilities and to increase the private sector contribution from 40 to 65%. Of course, targeting almost 2,300 primary healthcare centers and more than 290 hospitals. And one of our priorities is to localize and to manufacture our products locally inside the kingdom and become a regional hub for manufacturing products, medications, technology, biologics, vaccines, diagnostic tools. So those are our priorities. This is quick overview about the healthcare system in Saudi Arabia. Now I will go to the next slide with focusing on the number of statistical data for the mental health care in Saudi Arabia. So we have almost 2,400 beds for mental health and almost 500 beds for mental health rehabilitation in our hospitals. And of course, the percentage will go exactly similar to the percentage that I showed to you. 76% are governmental beds and the others are private sector. Starting from this quarter, we initiated some kind of national system that it will depend on connecting all healthcare facilities in prescribing and dispensing all of the psychotropics and mental health medications, including psychotropics and narcotics that it's used in Saudi Arabia in one organization, in one system that it's already connected to our national data center. So once you will put the ID of the patient, you will get all of his information in the prescribing form. If the patient is dispensing a similar or related mental or psychotropic medications from any other institution, it will appear immediately to the prescriber. If there is any drug-drug interaction or any duplication, immediately it will appear to the prescriber. And from the other side, the system also is connected to the Saudi Health for Saudi Commission for Health Specialties. Those are the agency, or this is the agency responsible for licensing all the healthcare practitioners in the kingdom. So if you are licensed to practice medicine or licensed to prescribe such medications, you can prescribe those medications. If you are a pharmacist, you are licensed to dispense, and you know and you are educated about mental health, you will be able to dispense these medications. Of course, this system is integrated through technology with all of other systems. This system launched in the first quarter of this year, And of course, it's connected to the national healthcare record of the patient. So you can check your prescription, or you can check your prescriptions from your mobile application, and for yourself and for your dependents, of course. And you can check if there is a medication, if there is a patient he's trying to dispense a medication from any other sector. So it will really help all the prescribers and dispensers. Prescribers, I'm talking about the physicians, and dispensers, I'm talking about the pharmacists all over the kingdom. It's not just only it covers community pharmacy, it covers governmental pharmacies, hospital pharmacies, private centers, all of those areas. And of course, this system is connected to a dashboard that we can monitor the heat map or the map of the Saudi Arabia, and we can check exactly where is the areas that there is some kind of problems in those areas, so we can go for it. Our system, or our initiative that it was launched early this year, is connected to the Ministry of Interior systems. Once any narcotic or psychotropic medication is dispensed to any patient, for example, this patient will have a revoked driving license. So as you know that driving while taking those medications, it may affect the patient's ability to drive. So it's very dangerous. So the driving license will be automatically, once the patient's on those kind of any medication, it will be revoked. And of course, you can monitor the dispensing and prescribing habits for the physicians, and you can make sure that all the patients are getting the right medication at the right time. If you can click next, please, I will have the medication errors, reporting the number of safety reporting errors. We reached, of course, we are enhancing everybody, or all, especially the pharmacists, to report of any medication error starting from near
Do we still hear Dr. Shinawi, everybody, or is it just from my side?
No, there are some problems with his sound. Dr. Mohammed?
Over to you, Marianne.
Dr. Mohammed, there are some problems with your sound. Please check your mic. No, it's still, Dr. Mohammed, it's still not going well with your sound. Can you check again?
No. 99.9% of them, they are, alhamdulillah, and we are in environmental area to report all of the screen in the bottom, the new chart, and of course, all the mental health medications are medication errors. Next.
Dr. Mohammed, sorry to interrupt, but I think for the past maybe a couple of minutes or so, your sound was not clear. So just wanted to make sure you realize that. So if there was any particular point that you wanted to highlight.
Dr. Sherif, thank you. Can you hear me now? Good.
Yes, we can hear you now very well. Yes.
Oh, sorry for that. Please accept my apology.
So, no, that's okay. So maybe just again, if you can look at...
this is our system here that we have the dashboard in monitoring all the mental health medications prescribing and dispensing. So through the dashboards, we can check the prescribing and dispensing habits. And we can also tailor our strategies based on whatever data that we are receiving. And for the last chart that it came, the number of safety reports, we also are encouraging all of our pharmacists, especially pharmacists, to report all of our incidents. Of course, 99.9% of those reported incidents or safety reports are near misses, so it didn't reach the patient. Patients can check all of their prescriptions and data through the mobile application, as well as for the physicians and for the pharmacist. You can dispense the medication from one location only. All locations, all the sectors, all the healthcare providers are connected to the system. So if you are prescribed this medication from hospital X, hospital Y will know that you already prescribed this medication. And as well for the dispensing, if you dispense this medication from a community pharmacy, the hospital pharmacy will know anywhere in the kingdom, everywhere. So if I can go to the next slide, please. Yes, those are the challenges that we are facing. And I believe everybody will agree with me that there is no unified regulations for the ability for the pharmacist to prescribe. I believe it is a great initiative that the FIP can recognize the mandate for a pharmacist as a primary healthcare provider to evaluate some kind of cases to the patients and start to prescribe. And of course, this has to be a unified regulation. When I go to the next, to the second challenge, there is no residency program for training for pharmacists. Pharmacists will come to you, why do I have to be trained, or why do I have to be specialized in the mental health? We need a structured training programs for pharmacists, whether they are in the hospitals or in the mental health hospitals or in the community pharmacies. Definitely there is a CME hours, there is a lot of training programs, but we are looking for a more structured diplomas, accredited programs that the pharmacist can go and they will be highly specialized in this. No enough public awareness of the role of pharmacists, especially for the community pharmacists in the mental health, providing a majority of our community pharmacies currently they are just only dispensers. They do not give a lot of attention for the clinical provided data to the patients, similar to the hospital settings. So we need all to give it a lot of attention for our colleagues in community pharmacy. Not enough publications regarding these important topics. Dr. Dalia shared with us the publications from the FEB, although that the researches and articles coming from every country, I believe it's very, very, very low in number. Not enough counseling clinics run by pharmacists. We need to have clinics, whether in community pharmacy or in the hospitals, run by pharmacists, not run by physicians, in order to review the medication profile and make sure that this MTM or medication therapy management clinics are specialized in the mental health and to help the mental health patients and to increase their adherence to the medication, and most probably to cancel any unneeded medication that it might be harming the patients future-wise. With this, I end my talk and thank you for the invitation. Thank you, Dr. Sherif. And sorry for the interruption of missing the voice.
Thank you so much, Dr. Mohammed, for this very informative presentation. And again, looking forward to our discussion very shortly.
Sure.
I would like to now introduce our next speaker, Dr. Neha Garg. Dr. Garg is a career bureaucrat with the government of India, bringing over 17 years of extensive experience in the public health sector. She earned her MBBS from Lady Hardinge Medical College in New Delhi. Currently, she serves as the director at the Ministry of Health, overseeing national programs focused on primary and secondary healthcare, with a special emphasis on mental health and health systems strengthening. Dr. Garg has held various leadership roles across health, finance, and the taxation sectors at the national level. Welcome, Dr. Garg, and thank you for being with us today. And I will now turn it over to you.
Thank you very much. Okay, so I hope I am audible and my slides are visible.
Yes.
Okay. So, I bring a little different perspective to our earlier panelists, as in I'm not a core pharmacist or associated with pharmacy in the core way, but more from the public health perspective and also from policymaking perspective. So my presentation is basically structured in giving an overview of the public health services in mental health in India and the role that pharmacists can play and what are the challenges that we foresee in involving pharmacists in a greater way in providing mental health services in the country. So starting with the, mental health as a challenge, globally also the prevalence of mental health has been a concern, especially it's an invisible illness. But more so is the treatment gap. So in India, we've seen that there's a treatment gap of around 70 to 92% with a prevalence of around 10.6%. And lately, the focus of the government has been on providing mental health services to everyone in the country. Next slide, please. This briefly shows the journey of mental health care, which started with the mental health program in 1982. And now in 2022, we've reached a level where mental health services are available on your fingertips with the help of a telephone call as well as at the smallest unit of mental health, smallest unit of health services in the country, which is called a sub-center. Next slide. So starting from the top, you're just seeing the continuum of care in a reverse way, how it is provisioned in India. We have specialized mental health institutions. And when I talk about these, they're all in the public, supported by the government. 3 by Government of India and 44 that are supported by various provincial governments. So if you look at the map, we can see that specialized services in mental health care have been traditionally available in most of the states in the country. There are 47 institutes in altogether run by the government that are supporting services in India. Next slide, please. Coming down from the tertiary level at the secondary healthcare level, we have a district mental health program. So district is the smallest unit of administration in the country in India. And in all districts of the country, we are providing mental health services, which are integrated with other services. So we understand now that provision of mental health services in isolation is not the way forward. Integration with general health services and integration at primary health level is the best way to avoid stigma and to ensure that services are provided in the most efficient way. So as we heard from our panelists from Türkiye, we have a team which is stationed at district hospital, which includes a psychiatrist, a clinical psychologist, a psychiatric social worker, and also community and psychiatrist nurses. But the advantage of it being a part of a district hospital is that services as those provided by pharmacists are available with the general health services that are otherwise present in the district hospital. Next slide. So this district unit focuses not only on provision of services, which includes counseling as well as dispensation of medicine, but also on capacity building of healthcare workers as well as of non-specialist health workforce, as well as teachers and college professors, so that there is an institutional capacity that is built in terms of human resources for mental health care. This team also focuses on awareness generation through information, education, and communication activities, because stigma reduction and awareness generation is a very, very important part of actually dealing with mental health disorders. Next slide, please. Now, coming down from the tertiary to the secondary and finally to the primary healthcare. So this may look like a very complicated pyramid, but I would request you to focus first on the left lowermost part, which shows that how India has expanded the services available at right near the doorstep of the people, at the smallest unit of healthcare facilities. So earlier, mostly the focus had been on maternal health, but now at this level also, we are focusing on providing services for non-communicable diseases, including mental health. And we have 175,000 of such sub-centers that are set up in the country through which we provide services for mental health. Then I would request you to focus on the top right corner of the pyramid, which talks about how private sector has also now been involved in providing services through health assurance schemes where hospitals are empaneled and services are provided through insurance to the vulnerable section of the society, including packages for mental health services, which include inpatient services and drugs as well. Next slide. So the Ayushman Arogya Mandir is the sub-center that I talked about. 175,000 of these sub-centers are there in the country. And these are the mental health disorders that we are able to address at this level. So there is basic level of identification and screening, and then referral to medical officers. And also drug dispensation happens at this level. So drugs that are prescribed by licensed practitioners can be dispensed at this level. Next slide. The last step, the latest step that we had taken is in the form of the telemental health program, where through a telephone call, mental health services are available, first through a counselor as well as through a mental health professional. We have now also introduced video calling on this facility. And if you're speaking to a licensed practitioner, a medical officer, or a psychiatrist, e-prescription can also be generated. So a person sitting at home can talk on the phone. He can get a basic examination done by a psychiatrist on the phone itself, and also receive an e-prescription, which he can later use to get the drugs that he needs. Next slide. This is the basic structure of the calling mechanism. So it's a very simple slide. You call, it connects to a counselor. If there is need, the counselor refers your call to a mental health specialist. And if need is felt by the mental health specialist, you will either have a video consultation or refer you for in-person services to our district mental health units. Next slide. We also have a Mental Health Care Act in place, which is a rights-based act, and it ensures that the rights of a patient with mental health conditions are protected, including the interventions that are done as per the consent of the patient, and with proper healthcare professionals in place to take care in need. Next slide. We also have a suicide prevention strategy. This is a very recent intervention, and we are now working on ensuring implementation. Again, a big chunk that there has been an increase in the rate of suicides, and this is something that we need to focus on. Again, another field where we can look forward to partnership with the health cadre of pharmacists. Next slide. So when we come to the role of pharmacists, what I see from a public health professional is, of course, first of all, dispensation of medicine is the most important role that our pharmacists are providing. However, what also happens is that there is a lot of comorbidity that happens in mental health disorders. So, because of stigma and awareness, a patient may not approach a health professional for his mental health disorders, but, they may be suffering from a non-communicable disease or tuberculosis, chronic diseases for which they would be regularly interacting with the pharmacist for getting the medication. So if the pharmacists are trained to identify the basic indicators of what could be a mental health disorder, they could really form a very, very formidable force, which would help us then in getting the referrals made to the right person for taking care of such people. Then, of course, providing guidance to the people on drug interactions. So what are the earlier medications that the person is on, and if the prescription has been from some other physician. So usually one person would go to, would have a pharmacist that they would trust and go to. So this would another important role that a pharmacist could play. So I forgot to mention that we have Indian public health standards that mandate presence of pharmacists in all healthcare facilities, right from the primary healthcare level. So an important role that can be played there is also the forecasting requirement of drugs and preventing stockouts. So psychotropic drugs sometimes take the backseat as far as prioritizing medicines are concerned in public health facilities. So depending on the patient load, if it can be forecasted correctly as to what would be the requirement, it would be a great help in efficiently using the drug supplies in the country. They would also play an important role in supporting the treatment adherence, especially for severe mental disorders that go on for a long time. Some of the challenges we saw in the, in the poll also in the morning, the biggest in the beginning of the panel today, the biggest challenge is in capacity building. So when we talk about involving pharmacists, ensuring that training is provided, but not just training, but also quality training that gives us the right outcomes, having the right kind of training programs is what I see as a biggest challenge that could be there. We also have inadequacy of manpower, especially with regard to adequately trained and skilled pharmacists that could be used, and that could also be, there could be task sharing and task shifting with regard to performing some roles related to mental health services. When I speak about rational deployment, I talk about both public and private sector. So in public sector also we see that there is a urban focus on deployment, but also in case of when we look at the retail chemists, there would be concentration in certain areas, and the rural areas are generally the areas that are left out. Then lastly, of course, shortage of medicines, frequent stockouts, non-prioritizing of psychotropic substances would be a challenge that would be faced by pharmacists, but eventually, of course, by the country. Next slide. Thank you so much.
Thank you so much, Dr. Garg, for this very informative presentation. And thank you again to all our panel for very informative and very great presentations. We're certainly looking forward to having a discussion with everyone shortly. A lot of good points shared, and certainly thought-provoking as well. And I'm sure that we will be having a lot of questions from our colleagues who are listening on the webinar. So please, if you do, make sure that you put that in the Q&A chat box. But before we get to that, we have a second poll question for you. So I will now turn it over to Dalia and Ozge to take it over from here.
Thanks so much, Sherif. Yes, so dear colleagues, we will launch the second poll now. Thanks, Marianne. We'll do it immediately. And the question as appears on the screen, which strategy do you believe would be most effective in improving mental health care delivery by pharmacists, now that you've listened to a wonderful 4 speakers? And this can also support some of the discussion during panel. I'm going to give you a few seconds. Thank you so much. Okay, we're ready to go, I think, Marianne. Thank you. Wonderful. Thanks for that, Marianne. We do have the results appearing on the screen, Sherif. And there seems to be a bit of an equal distribution between 3 items, but one prominent item is the second one, again, referring to specialized education and training programs. I'm going to just close that for a moment. Thank you.
I think this is a very good segue to our panel discussion. So maybe if I can just ask the team to stop the screen sharing, and if we can have everyone turn their cameras on.
Perfect. Thank you.
Excellent. Thank you. So again, excellent presentations. Thank you so much for your time and for sharing your expertise. Certainly looking forward to our discussion. And I know Dalia has a few questions as well to ask, but I just want to start by saying that it's very clear from what we've heard from everybody that pharmacists can and do play an important role whether on the traditional side, counseling, education, watching for drug interactions, improving adherence, or more so about being more involved in helping patients with the mental health. It's clear why, because we're accessible, we're convenient. People see us more than they see their doctors. I think this is universal across all jurisdictions. But it's clear that when we look at the answer to the first poll and the answer that we just got in the second poll, that it looks like training and the continuing education is one of the main identified barriers. So what I'm hearing from this is that pharmacists want to do more, but feel that they don't have enough skills on that particular topic. So the question would be, how can we make sure to address that part? Like, what more can be done to ensure that pharmacists don't see this as a barrier anymore? And also take it a step further. We have certified diabetes educators. So we have pharmacists that are certified in diabetes. We have pharmacists who are certified in. Should we also be having pharmacists certified in mental health? And so rather than we always look as a pharmacist, so that pharmacists can counsel on a lot of things, should we be having specializations? There are some jurisdictions that do have psychiatrists, pharmacists, designations, for example. So again, just wanted to open it up with that and would like to hear your thoughts on that.
Hello?
Yeah, please, though.
Yeah, thank you very much. I think it is a very important issue that you are coming, that the training and the education is the most important point to increase the competence of the pharmacists to deliver their work. The presence of these programs, it will help the pharmacist getting more confidence in himself and giving the consultation and all that. But it came to my mind that what's the role of pharmacists? We have to look for it from different. What we were discussing, also the role of pharmacists in healthcare through disease management and medication management. This is a very important role, which we emphasize in it, we focus in it. But we have another role that from my being a professor in the university and through our education programs and learning outcomes, course learning outcomes and all these things, which is based on competency based programs we are delivering from the university. We see that the pharmacist, through the training and through the education, he is in high competence. He can also help in an early stage of identification of these patients through screening and early identification from the community pharmacy. By, as Dr. Guorgui said, that through identifying certain signs and symptoms of these pharmacists from the community service, he can direct the patients to be referred to make more investigation and to confirm what he got. These two things is like, for example, sleep disturbance, appetite disorders, sleep disorders. This is very important that it can rely on it some of the psychiatric problems like depression or anxiety. So this is, if he got a sleep disorders like insomnia or hypersomnia, it can be more a trigger to the pharmacist that they can help them, that they have to take more diagnosis or to be referred to as specialized doctors. In the primary healthcare, they can identify it also to them and supportive our diagnosis. This is one of the issue. Appetite, we have a lot of people with overweight or underweight, which they are suffering from certain degree of mental illnesses. So we are telling them that we can support them through identification from the community pharmacy and screening this. So early identification will make an early control on the disease before it's becoming more aggressive or more chronic with him. This one of the things that I want to say, that also developing a training and continuous training programs, specialized, as you said, certifications, will help also the pharmacists to deliver in a better way. We have also a group of patients which indicated to got some depression, like the elderly, like the cancer patients, chronic disease patients. Most of these, especially diabetes, they have a trigger of getting also mental depression or something. These people, if the pharmacy from the community can identify them and help them, will be a big role in the pharmacists to be involved in that. Also, we have another things, the WHO guidelines on mental health at work. This is very important. We have to listen to that. They estimate that 15% of the working aged adults have mental disorder at any point in a time. This depression and anxiety are estimated cost of a global economy of like $1 trillion per year, driven by loss of productivity. These things also pharmacists, he can identify it from the community services. Thank you very much.
Thank you so much, for that very, very insightful. Anyone else would like to chime in on this particular point about the barrier?
If you allow me, I would just add one thing to Dr. Nadia, what she mentioned, amazing. However, I believe that this is the time now to move from theoretical part to a practical part, to engage our policymakers in putting some regulations. In our Arab countries, or up to my knowledge, our countries that it's represented in this presentation or in this webinar, we don't have clinics. We don't have a rule or a regulation to indicate that we must have clinics run by pharmacists inside the community pharmacy. Although that we all agree that pharmacists, they are number one healthcare practitioner, they are facing the community, very frequent, the community is trusting the pharmacist. However, we did not put this regulation. Shall we have a clinical pharmacist run clinics inside the pharmacy? Or how can we should give it, all of us, we agree, even for the voting, they agree that we should have some kind of training program. How can we design this training program? How can we make it a structured training program? So we can open a clinics. Everybody knows about the MTM clinics, medication therapy management clinics, with a focus on diabetes, cardiovascular, mental health, women's clinic, all of those requirements. How can I prepare the pharmacist? None of the pharmacists graduated from any university or any college with this knowledge. How to cover, how to open this clinic inside your pharmacy. We all trained how to calculate the tablets. What's the fee, the first expiry, first in, first out, or the FIFO theory. But we never been educated how to deal directly with the patients inside a clinic. Although we are saying always that we are a part of the health team and one of the most important thing, we need to translate all of our activities that we are doing to a dollar sign. So we can go and tell all of the healthcare policymakers in the country that because of having the pharmacists running clinics inside their pharmacies, we saved the government or we saved the patient this amount of US dollars. Otherwise, nobody will invest in the pharmacist in order, I have a clinics. Dr. Nadia, she mentioned the pharmacist can transfer the patient to the health, if he figured that there is certain criteria for that patient. I am going to further to allow the pharmacist, once he diagnoses the patient, to prescribe certain medications. I'm not going for the specialty, or I'm not taking the responsibility of the physicians. However, the pharmacist, for minimal things like sleep disturbance, he can figure and he can diagnose, and he should have the ability to prescribe. No need to transfer the patient again to a clinic reviewed by a physician. And this is happening in a lot of countries. The pharmacists have the ability to diagnose and prescribe certain medications. However, in our countries, it is still under negotiation because it still did not prove itself 100%. Although our pharmacists in community pharmacy, they are sometimes violating the policy of dispensing per prescription, and they are dispensing the medications without having the prescription is there. So training, structured training, giving authority to the pharmacist, educating them, and I highly emphasize about opening clinics, not just only a pharmacy, open clinics, sit with the patients. It's not in the community setting. If you don't have a closed area to discuss with the patient will not talk to you. So having a clinics inside the community pharmacy is a must. It is as important as the location for cosmetics or for non-pharmaceutical items in the community pharmacy. So having this small area with one desk, two people, pharmacist and the patient, will really emphasize, and it will enlarge and maximize the role of pharmacist outcomes in the community setting. Thank you.
Thank you so much. I think I can't really agree with you more. Like everything you're saying is spot on, and we're seeing this in Canada. Exactly the model that you've been talking about. Again, not in all of the provinces in Canada, but we started to see that momentum in some jurisdictions, some provinces, where there are pharmacist-led clinics. And they are actually in some provinces, mainly in Nova Scotia. This is heavily supported by the government for one reason and one reason only. They see the benefit. They see exactly like you're saying. It does save the healthcare system, not just on the money side, but it increases the capacity of the healthcare system. You have a pharmacist that is on every corner, where within walking distance from a lot of the population. People can often go in and easily have access to them. So by utilizing their expertise and also expanding their scope, because that's the other part too that you've mentioned. So there are a few parts. The first one is working with policymakers and with government to expand the scope to allow pharmacists to assess and to prescribe for medications. And then the other part, which is also you touched upon, is the reimbursement piece. Like this has to come at a reimbursement, because we do save the government money. And there are a lot of examples that we can share. Again, this is the beautiful thing about FIP, is that we can have a lot of knowledge exchange from different countries. So we've had some examples in Ontario, for example, where we've started last year with having the minor ailments scope in Ontario. And I apologize, just the sun is just rising in my eyes right now, so it's early morning here in Toronto. And what happened was after within a few months, 6 months of having the government give us the scope to do so, they've come and they asked us to do even more. So they gave us scope for even more minor ailments, and very recently even increased it even more. So the main, again, to speak exactly to your point, it's they're seeing that it's saving the healthcare care system funds, and it's also increasing the capacity, and this is also being reimbursed. And I think the other point that you did mention is regarding the the training, which I think seems to be the main thing that we have to keep coming down to, is making sure that pharmacists have the necessary knowledge and skills and abilities to be able to confidently perform those services. Dalia, I see you have your hands up, please.
Thanks, Sherif. I just wanted to mention we can launch our last polls so that you can see what the audience are thinking about the evolving role of pharmacists in this area, which actually reflects Dr. Nadia's first comment that she first made. So before you go to Dr. Niha and Dr. Zaki, if you like, Sherif. We can launch the last poll. Thank you, Marianne. Thank you so much. And we don't need the slides, thanks. Ozge, if you don't want to. And it is, how do you envision the role of pharmacists evolving in mental health care over the next 5 years? As primary caregivers within the mental health team, consultants within multidisciplinary teams, mainly focusing on dispensing and medication management duties and patient counseling, or you do not see or foresee any significant change from these roles? Just for the panelists to reflect on, as Dr. Niha and Dr. Zaki as well would like to do that. Thanks for that, Sherif. And I think that will answer some of your questions as well, colleagues. Okay. Thanks, Marianne. Let's see what people are thinking. Okay. Over to you, Sherif, and guests. Thanks, team.
So I think I saw that briefly. I think the majority see pharmacists playing a bigger role as consultants, and again, which is very encouraging to see that, because it's exactly along the lines of what everyone has been talking about here, is how do we continue shifting from the pills to the patients? How do we continue to shift from the dispensing to more about having those clinic models that Dr. Shinari was talking about? I know that we are getting close to the end of the webinar, so I would like to see first if we have any questions in the Q&A that we may want to take.
Thanks for that, Sherif. I think one question that we received in the Q&A was a general one about, are we aware whether mental health acts are universal across different countries? Perhaps we can answer that very quickly.
Sure. Yeah. So anyone would like to take that?
Dr. Niha, thank you.
Yeah. So I don't think that mental health care acts legislations pertaining purely to mental health care act are universal across different countries. But I believe that different countries have their different legislations and are at different stages of legislating as far as mental health care act is concerned.
Excellent. Dalia, I know you wanted to touch a bit on policy.
Yeah, thank you. I think we would love to hear from our speakers about how to engage policymakers more. What are their thoughts on that to support advancing the role of pharmacists, supporting the public with mental health? So we really would like to come up with some recommendations, if possible, from all of our speakers, and potentially, Sherif, we could start with Dr. Niha and then go to Dr. Zakia and we go around. Thank you so much.
Thank you very much. That's a very interesting and pertinent question. So before I come to that, I also just wanted to mention that I had the opportunity to look at the FIP resources that you've put out on mental health care yesterday. And I must say, I must congratulate the team. It's an amazing job done. And if there could be contextualization and customization of those resources for different countries, it will be a very, very big help. The first step towards when we talk about capacity building and trainings in sensitization of the cadre towards mental health care specifically. When we talk about engaging policymakers, let me be very honest. In India, there are regulations as of now which allow pharmacists to dispense medicine. And this is not specific only to mental health but also general health services. So one of the best ways I would see is that, policy these days is evidence-based policy. So if we could get good examples from countries where this has been implemented, like we just heard about Canada, and good results that are coming through. And if those countries could be contextually similar across the geographies, then of course there would be an interest in seeing what is a way to better involve, increase the role of pharmacists in providing services. Having said that, I would like to say again, it's very encouraging to see the result of the last poll, which, there were only 4% people who said that they do not see no change happening. So, we are on a very positive note there, that there is this desire and there is hope that things will change, and I'm sure that they will. And we are looking to a time where we can look at more involvement. And also in India, we've worked in certain other health programs where pharmacists have been involved in helping dispense awareness as well as treatment adherence, for example, tuberculosis. So maybe slowly we could also look at the results of those programs and see if we can have policy modulated for mental health as well. Thank you.
Thank you, Dr. Guorgui. Very informative. Dr. Yilmaz?
Yeah, thank you. I want to make some additions. I want to mention about the history of clinical pharmacy. And at the beginning of the clinical pharmacy, we see that the government supports clinical pharmacy when they see the benefit of clinical pharmacy to patient care. So if as a clinical pharmacist or as pharmacist or as a university, if we can show the benefits of including pharmacists in the mental health care plans, teams, or in such kind of patient education decisions, it's better to policy to better understand that including clinical pharmacies provides beneficial effects for the patients, for the society, and for the government. And so it's better for them to support the pharmacists, I think. Of course, it's a long duration. It's not easy to do it from today to tomorrow, but step by step, we can integrate it to our system. And in Turkey, if I talk about the special context of the Türkiye, we have clinical pharmacy specialists in some hospitals, in inpatient settings, in inpatient clinics. And step by step, we see their benefits for the management of the patient treatment plans, for the counseling with the other healthcare team members, etc. And so thereby, they understand the benefits of the pharmacists being included in the teams, healthcare teams. I think this is a very important step to show the policymakers the importance and need for getting pharmacists in these teams, and thereby some change will start in the future step by step. Thank you.
Thank you so much. Anyone else? Dr. Mazrui?
Yeah, thank you very much. I think as Dr. Yilmaz, she said that it is a progressive things. It is development of the profession, which is happening in all the professions. The development from the pharmacist from a drug-oriented or customers to a patient care settings. This is the development of what will happen. Now it will be more emphasizing or focusing on more roles for the pharmacist. I think the governments, they are involving in UAE especially, and I think worldwide, we are involving a pharmacist in decision making, as a decision maker in many committees for the healthcare programs. Now we are concentrating on mental health. So there is a role of pharmacists in that, and but mainly if you are speaking about the community pharmacy, they are a little bit away, because they are serving more the private sectors more than the governmental sectors. But in the governmental hospitals or the university hospitals, there is an involvement of pharmacists in many aspects. But what we are asking for is more involvement. As we know, by time it will come, because they will get more trust and more. And I want also to concentrate on something that the education is being also developed. The pharmacy education, as I am now, I'm teaching psychiatric medicine, I'm teaching mental health in the university. Also, I'm teaching OTC. But these all things, when you are experience all these with your students, so they are going to be of a value in there. But the education always filling the gap between the science and the education and the workforce. So our aim is to as I told you, to build the competency of the pharmacist to be a competent pharmacist for different roles. If you see the clinical pharmacist, you have a many specialization. Now, you have a psychiatric pharmacist, but he is a pharmacist in the psychiatric clinic, which is a tertiary setting. We are calling for primary setting, as you said, to be more involved, the pharmacist in the primary settings. Thank you.
Thank you so much. It's a very interesting conversation. I think we can easily have this conversation with this fantastic panels of experts for another hour. So I think Dr. Al-Shenawi will give the last word to you on that.
Thank you, Doctor, and thanks for all the speakers. Their comments are excellent comments. I just only remove the hat of the Saudi Pharmaceutical Society, and I will wear the hat now of the policymaker as the General Director of Pharmaceutical Care in the Ministry of Health. I will tell you one thing that the FIP can help greatly in it is to having as an international body recommendation. So, for example, if the FIP I reviewed, and you cannot imagine the 21 development goals of the FIP, how much we are using it in communicating with our bosses. However, some kind of development goals, it needs a little bit or some clarification. How can we implement it? For example, in the mental health, I can see it in the developing goal, number 15, patient-centered or people-centered care. So this will help us a lot. Even, for example, if the FEP can recommend having clinics inside the pharmacy by a certain percentage, not just only as a recommendation to have these clinics, and these clinics will serve in 1, 2, 3, 4, 5, 6, and it will have those pharmacists required training in this. So the international recommendation body like the FIP will greatly help us as a policymaker to implement any change in our countries. Otherwise, the resistance, as you all know, will face a lot of resistance. Oh, we are good now. We do not want to change. We do not want to develop. However, the recommendation from the international, such as FEB, it will be a great help to all countries. If I'm talking about Saudi Arabia, we depend a lot in the development goals that it's already published by the FEB. So if anything like this published and supported and recommended by FEB, definitely, it will be a great help. It will save us 50% of our efforts in order to achieve our target. Thank you.
Thank you so much. So good way to wrap this up. And I think, certainly from what you said, there are some takeaways for us. And I look here to my colleagues on the FIP team, for us to take back internally and see how much more we can support. As Dalia had shared earlier, there are a lot of resources and work that FIP has already done on this matter, but we can always do more, and that's why we're having these forums and these discussions to learn from you on what exactly that you need for us to be able to better support your work in your country. So thank you for that, and again, some good takeaways for us. So with that, I just want to give you a quick reminder that if you wish to listen to today's webinar again, or if you want to invite a colleague to listen to it, the recording of the webinar will be made available on our website at events.fip.org. Also, when you're there, you can check out our upcoming events and register to attend them as well. And also want to quickly take this opportunity to invite you to join us at the next FIP Congress in Copenhagen next year. It's a great opportunity to network with colleagues from around the world and to share ideas and to learn from best practices. So make sure you mark your calendar. And to learn more about the Congress, please visit the website that you see on the slide at Copenhagen2025.fip.org. And if you'd like to attend, it would be good to take advantage of the early registration fee and register before June 2nd. So with that, I want to take this opportunity to once again thank our distinguished speakers for joining us today and for sharing their fantastic presentations with us. Thank you for making the time, and also want to thank all our colleagues for making the time to attend the webinar today. I'm sure you found it to be extremely informative. So have a great rest of your day, and we'll see you at the next event.
Thank you very much, colleagues. Thank you very much, Sherif. Thank you.
Thank you.
Thank you.
Thanks,
Thank you
team.
for your invitation.
Thank you.
Thanks.
Thank you all. Have a